Introduction to lymph nodes of the neck. The neck lymph nodes are divided into 7 levels, based on the area they drain. The levels of lymph nodes are: Level 1A, Submental. Level 1B, Submandibular. Level 2, Upper Internal Jugular. Level 3, Middle Jugular. Level 4, Lower Jugular. Level 5, Nodes in Posterior Triangle of the neck. Level 6, Anterior or Central Compartment Group. Level 7, Superior Mediastinal Nodes. Lymph nodes of the neck can be examined by standing behind the patient, with the patient's neck slightly flexed. The nodes are palpated from above downwards. Submental nodes are palpated in the submental triangle, below the chin. The submental group is present between the bellies of the digastric muscles and drains the chin, central part of the lip, gingiva, floor of the mouth, and tip of the tongue. Submandibular nodes are examined in the submandibular triangle. The submandibular group is present posterolateral to the anterior belly of the digastric muscles. If affected, one should examine the palate, the tongue, floor of the mouth, the lower lip, cheek, gingiva, nose, and antrum. The tonsillar nodes are examined just below the angle of the mandible. The tonsillar node lies at the junction of the facial vein, and the internal jugular vein may be enlarged in case of inflammatory or neoplastic lesion of the tonsil. Level 2 is divided into Level 2A, inseparable from, or anterior to the posterior edge of the internal jugular vein, includes jugulogastric nodal group. Level 2B, posterior to and separable by a fat plane from the internal jugular vein. The deep cervical nodes are palpated on one side at a time. Fingers are rolled over the deeper muscles, along the carotid arteries. Enlarged deep cervical nodes are seen in tuberculous lymphadenitis. Posterior auricular nodes can be palpated just behind the ears. Drain the efferent lymphatics from occipital, retroauricular, occipital, parietal, and scalp nodes. Occipital nodes are present over the occipital protuberance. Their afferent vessels drain the occipital region of the scalp, while their efferents pass to the superior deep cervical glands. The scalene nodes are palpated deep to the lateral head of sternocleidomastoid muscle. Supraclavicular nodes are palpated in the supraclavicular fossa. Enlarged left supraclavicular nodes are called Virchow's nodes, also called Troisier's sign. It occurs due to metastasis from stomach or testicular malignancy. One should examine not only the arm, breast, and chest or bronchus, but also the abdomen, right down to the testis. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.